Hello, my name is Bevelyn Ofori. Welcome to my channel. Pregnancy lasts around 40 weeks and the 40 weeks is divided into 3 trimesters. We have the first trimester, second trimester and the third trimester. In today's video, we are going to talk about the changes that occurs in the body of the mother during the first trimester of pregnancy. The first week of pregnancy starts from the first day of your last menstrual period. So during the first week, your body is preparing for ovulation. The eggs in your ovaries is getting matured to be released out during ovulation, and also the uterus too is preparing itself for possible implantation. So during the first week of pregnancy, you're not really pregnant, or that period is the start of your menstrual cycle. We are now in the second week. The second week is when you ovulate during menstrual cycle. That is, if you have 28-day cycle, you will ovulate in the 14th day. And if you have 35-day cycle, you will ovulate on the 21st day. After ovulation, if you have had an unprotected intimate with your partner and there's a male gamete in the fallopian tube, this can fertilize the ovum during ovulation. We are now in the third week. During the third week, this is when, if there is fertilization, then the fertilized egg will travel through the fallopian tube into the uterus and embed itself into the lining of the uterus, and this is called implantation. If there's a successful implantation, then we can officially say that you are now pregnant. So women officially get pregnant during the third week of pregnancy. We are now in week 4. In week 4, this is when you've realized that you've missed your period. Most of the time during this week, if you've missed your period and you do a home pregnancy test, you will get a positive result showing that you are pregnant. That is why it's very important to go and see your doctor or midwife immediately you missed a period. From week 5 to 6, this is the period that you now know that you are pregnant. Most women would have confirmed pregnancy, and if they are pregnant, they will know that they are pregnant. During this period, you wouldn't really see a lot of changes in your body. Most of the time, during the first week to the 6th week of pregnancy, all the changes that you will get are the changes that associate with menstrual cycle and ovulations. You wouldn't really get a lot of massive changes in your body during this period. So from the 5th to the 6th week of pregnancy, it's important that if you haven't started taking your vitamins, you have to start taking your prenatal vitamins, especially folic acid. The growing fetus needs it. Also, make sure that you call your doctor or midwife to book for your first appointment when you are pregnant. And this appointment is called a booking appointment. We are now in week 7. During the week 7, your womb is now like the size of a lemon, and you're probably feeling more tired during this period. Your breast might also feel sore and enlarged. You may also start to urinate a lot more than usual during this stage. You may also start to feel sick and other minor pregnancy problems such as constipation, fainting or syncope, feeling hot, warmer or sweating a lot, changes in your skin and hair, and etc. Nausea and vomiting, that is morning sickness, normally occurs around this week and improves as the pregnancy is advancing. Especially, it normally improves around the 14 weeks of pregnancy. Or some people too will have it till they deliver. And most of the time, people who have severe form of nausea and vomiting called hyperemesis gravidarum will still have it till they deliver their baby. During this period, if you have any form of infection, when you call your midwife, let your midwife know the type of infection that you are having so that they can start giving the appropriate care now that you are pregnant to prevent transferring any form of infection to your baby. You may also experience sore or bleeding gum during this stage. That is why it is very important that during pregnancy, you practice a good mouth care, and you can also book an appointment with your dentist so that they can provide you a better dental care when you are pregnant. We are now in the 8th week. The baby is still developing. By this week, your baby is still like the size of a lemon. You will still be feeling tired and your breast might still continue to enlarge. Because you called your midwife or your doctor, immediately you find out that you are pregnant, you may be offered your first midwife appointment during this week, and this appointment is called the booking appointment, so that your midwife will gather all the information about you and this pregnancy for them to give you the appropriate care you need during pregnancy. We are now in week 9, and during the week 9, your breasts will have gotten bigger and larger, and even if not that, you will start to feel some sensation and heaviness in your breast. It is advisable that during this week, you start changing the size of your brassiere or start wearing a brassiere that is more bigger and more supportive so that it can support your breast, which is getting bigger or larger. Because there's a lot of hormonal changes during pregnancy, by this week you will start to feel a lot of emotions. Your body is changing. You can't eat, you can't sleep, you are stressed, you are tired, you're having nausea and vomiting, and all this can cause a lot of emotions and anxiety. A lot of people tend to have changes in their emotions during this stage of pregnancy because the pregnancy is advanced and your body is going through a lot of process to keep you and the baby healthy. You sometimes be angry or crying over nothing. It's all normal. It's part of the pregnancy. Your hormones is changing. A lot of things is changing in your body, so it's very normal. Whenever you are feeling sad or any form of emotions that you need help, you have to ask for help. You can always call your midwife or your doctor and they can give you the appropriate advice on how to manage all these sets of emotions during pregnancy. You may also start to experience more vaginal discharge during this period, and it's very normal when you are pregnant. But remember to tell your midwife or doctor whenever these discharge have an unpleasant smell or you feel like the discharge is more than normal. And also, if you have any itchiness or painful during urination, you should tell your midwife or doctor. Some of these signs could be vaginal infection. So if you feel like you are having discharges, you can tell your doctor or midwife for them to check it out for you and get a treatment if it's any infections causing that. We are now in week 10. Your body is still changing because the baby is growing. During this week, you will still see a lot of changes in your body as the pregnancy is advancing. Week 11. During week 11, some women will start to experience headaches, and it's very normal during pregnancy. But if you feel like the type of headache that you are experiencing is more than normal, then you can speak to your doctor or midwife for them to investigate for you, and if in case you need any form of treatment or for them to check out for you whether a different thing is causing those kind of headaches. Sometimes taking caffeine during pregnancy can cause these headaches, and also it can cause miscarriages. So it's very important to stop taking any form of caffeine when you are pregnant to limit these issues. Finally, we are now in week 12, and this is the last week of the first trimester. During this week, you might feel you are a bit constipated. Your body is still continuing to grow and change during this period because your baby is now growing day by day. As a result of that, the changes that occurs in your body during the first trimester is not as obvious as the changes that occurs in your body during the second and the third trimester. During the first trimester, you're still in the early stage of your pregnancy, so it is very important as to let your midwife or doctor know about any changes that you are concerned about so that they can address it immediately to prevent any health issues to you and your baby. This is the end of this video. See you in my next video. Bye.